Hello and welcome. This is the Freedom Nerve Restoration Program. We're going to be explaining how we've helped over 2,000 patients reverse their neuropathy without drugs or surgery or amputations, even if they were told it is permanent and where other methods have failed. Here's my big promise to you. I'm going to show you how to improve your neuropathy symptoms by between 60 and 100%, even if other methods have failed. I'll give you a complete understanding of what causes neuropathy and how we fix it, and finally, how to get your life back. If there was a way for this to happen, could you be committed to it? So who is this for? Well, if you've been suspecting you may have neuropathy or you've been diagnosed with neuropathy and you've tried everything, but nothing has worked. You're frustrated with traditional methods and you want lasting results, and you're ready to do whatever it takes, then this is for you. Now, who is this not for? If you believe the sick care model will work, when we talk about the sick care model, we talk about really just only treating when it's the worst of the worst, using medications and surgeries and those kind of things instead of actually changing the body and getting healthier. And if you believe that method is more valuable than actually getting healthy, then this probably won't work for you. If you're all about wanting more medications or wanting more surgeries, this is not going to be for you. If you believe insurance company love you and they want to do the best for you and they want to get you well and keep you healthy, I think that this is probably not for you. That's not what they're designed to do. Insurance companies are a business. They're designed to make money. Or if you can't be committed to your health, and you're not willing to invest time, energy, or even finances into your health, then this is not for you. This is the most innovative solution to neuropathy that I've seen. Now, doctors manage the neuropathy. Treatments are designed to cover over your symptoms. So I don't know about you, but if I had to take a medication or something, whatever that treatment was, that just covered the symptoms, but really didn't change the underlying cause, that's what we call managing it. I'd rather find something that found an underlying cause. The treatment is often generic. Okay, if we have neuropathy, here's what we're going to do whenever we have that neuropathy. So a lot of times it starts with using some type of drug or medication to cover those symptoms. You want to do something to help you not feel the symptom that you're dealing with. And if that doesn't work, eventually, this condition can lead to an amputation. Now, the system that we have, the innovative system that we use, the Freedom Neuropathy Program, we look more towards finding the root cause instead of managing. We're actively looking to reverse neuropathy, not just to treat a symptom. We're not just covering over or masking your symptom or your pain or your numbness or your tingling. We want to literally find what's causing it, the root cause, and then work towards fixing that root cause if that's possible. We use custom protocols that are specific to each patient. So our system is designed around finding out why you develop neuropathy, not generally why is there a neuropathy, but why did your body grow this? Why did it allow it to come? And there's natural ways of improving your overall health. So it doesn't always rely on a drug approach or a surgery or an amputation or those kind of things, but using natural methods that can actually improve your overall health while helping to reverse the symptoms you have of neuropathy. And of course, the treatment is designed to be easy to do so you can have long-term improvement, but also long-term prevention, and you can keep this so you can actually stay well. And to me, that sounds like a much better system. I don't know if you know, but neuropathy is the number one cause of amputations. There's 185,000 amputations every year, which is approximately 500 a day, people having amputations. The problem with this is that from the time you develop that first sore or that ulcer that develops on your leg or foot to when it gets bad enough because of the lack of blood supply going to it that there ends up being an amputation, on average, about 3 years. And after you get an amputation, between 3 and 5 years, 70% of those people will be deceased. Now, who am I? My name is Dr. Jason Tripp, and We've been serving neuropathy patients now for 20 years. We've helped thousands of people. I knew at 5 years old, this was the calling of my life. I knew that I was going to be a doctor, that I'd be a chiropractor, be able to help people with just my hands, to help people get well without drugs, without surgeries, and I would be able to help people get lasting results. So I became a doctor of chiropractic, doctor of naturopathic medicine. I'm board certified in clinical nutrition, board certified in integrative medicine. I'm a fellow from the American Association of Integrative Medicine. I'm primary spine qualified. I'm on the medical advisory board for spinal decompression. I have 8 degrees altogether, over 125 certificates of training. I'm certified in non-surgical decompression, certification in neuropathy. I'm author of 4 books. One of them is on how to heal your neuropathy. And I've instructed nationally around the country on a variety of topics. I'm also an ordained minister at a local church body. And I've invented multiple techniques to help people to get well faster. But that's not really why I'm qualified to teach you today. I'm qualified to teach you because I was sick, and I mean real sick. I had a lot of problems. It started with a really horrible accident I had when I was 17 years old, and it ended up bulging and herniated 7 discs in my back. And because those discs relate to the nerves and pinch the nerves, they go not only to the areas that cause pain, but it also can go to the organ systems. My body began to degenerate, and over time it was back pain, neck pain, shoulder pain, hand pain, hip pain, foot pain, headaches. It turned into depression, anxiety, irritable bowel, gastritis, thyroid issues, fibromyalgia, chronic fatigue, prostate. The list goes on. Like, I had stuff getting worse all the time. And with the neuropathy, as bad as it was, I knew if I was going to get better, I had to do something to improve, to learn how to get this thing on the right track. And so over 26 conditions, diseases, disorders, what have you, over 25 years of pain and suffering. And I studied, experimented. I worked hard at finding answers, and I was finding answers so I could really get me well. And then along the way, I found out how to get a lot of people well in a variety of conditions. So it wasn't just neuropathy. It wasn't just back pain. It wasn't just any one condition. There were so many things that I learned. And that's where the TriWell Plus and the Freedom Nerve Restoration Program came in. The TriWell Plus is a diagnostic and treatment system that focuses on finding the root cause of the problem. In other words, I address neurologic, metabolic, and structural imbalances that can block your healing. We all know that our bodies are made to be healthy. That's the way God made your body, is it's supposed to heal itself. If you cut your hand, it heals. If you break a bone in your arm, you know it heals. So if your body can heal from a broken bone or from a cut on your hand, why is it not healing from a neuropathy? Something is blocking your healing. Whatever that something is that's blocking your healing, we need to find that and address it, and then your body will go back to doing what it's supposed to do already. You'll go back to healing. You'll reverse your symptoms, your body will get well, everything will be good. But finding it, that's the key, and that's what the TriWell Plus diagnostic and treatment system is all about. We look at it neurologically. How are the nerves? Why are the nerves bad? Is there a brain issue? Is it peripheral nerves, spinal nerves? We look at metabolics. On the metabolic system, we're looking at, is there inflammation in your gut that could be causing this? Do we have deficiencies, toxicities, biotoxins, heavy metals? There's so many things we look at. And structural, whether it's a bone, a ligament, a muscle, what have you, oftentimes has led to nerve problems and or neuropathy. So why am I qualified? Because I'm obsessed with achieving maximum health in my own life. And when I see people suffering with things like I had, neuropathy and back pain and neck pain and shoulder pain and gut issues and thyroid and irritable bowel and fibromyalgia, I just can't help it. I have to do something. I'm obsessed with helping other people stop their suffering because I was there. So imagine, just for a moment, imagine that you don't have to miss out on family time, that you're not missing out on being active, missing out on travel, missing out on life, that you're not staying a prisoner to this condition. And imagine for a moment that you can take long walks with your spouse, walk or hike or golf or pickleball, or just to be active, whatever it is you like to do to be active or to travel. imagine that you get your life back. Man, what a change. And it makes me think of Rose. When Rose came to me, she had severe neuropathy. She had burning, numbing, pain, itching. Her feet and legs were hard. She felt like there was no blood circulating, and she was a diabetic. It was hard for her to walk. Now, she admitted to me that the reason she came to my office is that she was afraid of amputation. Now, after our treatments, no more itching, burning, tingling. She can walk on her feet, and her diabetes is gone. It was reversed. This is exciting. I'm telling you, when you can see this kind of change in people, when you can see that they're no longer worried about their life or about losing their feet and what's going to happen to them if they can't walk and somebody else has to take care of them, it has been amazing. And Gene had neuropathy, numbing, tingling, pain, cold, and he said he falls a lot. He had balance issues. His biggest thing, being afraid of being crippled. Some of you can relate. And now, in only a few weeks, he said he's 90% better. He's doing amazing. I just love seeing these success stories of people who are in those positions and yet now they're not. Now, Mark came to us with lower back pain and he had numbness and tingling in his feet. So he had both neuropathy and a back issue, which is common. He said it was hard to walk or ride a bike or golf. He was concerned about really not being able to function. Now, after treatments, his lower back pain is gone. His neuropathy is gone, and he got his life back. Or how about May? She had neuropathy in her hands and feet, and her blood sugar, her A1C, was out of control. She had trouble walking and wanted to really go to her granddaughter's wedding. That was one of her goals of her care. And now her hands and her feet are better, and her blood sugar is better. She is super happy, excited about being well. And Linda, I love this testimony. You're going to see why. When Linda came, her neuropathy was in her right foot. So it can be, most of the time it's in both, and it can be in one. And she couldn't wear heels. She couldn't feel the gas pedal when she was driving. And frankly, that's a little scary. She was concerned about getting worse and not being able to drive, which would take away freedom. After the treatments, it's been magnificent. I'm quoting her. Her neuropathy is gone. No more neuropathy. She said, Dr. Tripp is my hero. That's my favorite part. And she feels great. That's awesome. Like how much change we can make and see. Now we do have some 5-star reviews that you can find on Google. Here's Cindy saying, you know, her granddaughter's a patient there and the results were awesome. Lorenzo, he got better. He's so grateful for what he's seen. Teresa, Bob, James, Linda Philippone, she's improving. Deborah got better. Terry, Chris, Janet, and the list goes on. How many are there? Now we have 4.5-star ratings on Google, which means we're doing good. We're taking care of people. And these are people that are just like you. They started out having pains and problems and neuropathy and symptoms, and now they got their life back. But how did they get this? How did they get these outcomes? Well, number one was accurate physics-based testing. Number two, a custom neuropathy freedom plan. Has to be custom. No two types of neuropathy are alike. And they had to activate that nerve healing. They had to make it work. So accurate data means testing. We need to find out what's going on. The freedom plan, you need to know what it is that you're doing and then accelerate the healing. That means that we need to stimulate whatever needs to be stimulated, act on the plan that we have, do something. I call that section of it massive action. So here it is, the 3 steps: accurate data, get the test, find out what's going on. The freedom plan, what it is you're supposed to do, create a list of whatever treatments are needed for you to get better. And then number 3 is actively do them, like accelerate the healing, make it work. So the problem number 1, accurate data. When we're looking at accurate data, the problem is traditional testing is really using the wrong target. It's symptom-based testing. So where's your pain coming from? Not how do we heal the body? And that's a totally different target to look at. So when we're looking and you see surface level testing, we're going to get surface level data. Meaning if I'm only testing for where is the symptom and not where is the actual problem coming from, where's the root cause, I'm not going to find the root cause. I'm going to find symptom-based stuff. And so if it's symptom-focused care, that means you're not getting to the root cause. If you don't get to the root cause, you may temporarily get where you feel a little bit better, but the root cause isn't fixed, you're not actually going to be better, which is an interesting thing because, I can take 10 or 15 Tylenol. I don't recommend that, by the way. I can take a bunch of Tylenol and not feel pain. I could take morphine and not feel pain, but that doesn't fix anything. You're just temporarily not feeling what that thing is underneath. So if you want to actually get better, you got to find that root cause, and focused on symptom care and symptom focused testing is a recipe for frustration and lack of results. What we do is we want to look and say, okay, where is the puzzle? What is it supposed to really look like? You need to see the whole puzzle all at one time, because if not, and we just go, okay, I'm just going to ignore it, I'm going to do no testing. And a lot of people do that with the neuropathy. I hope that's not you, where you're like, I've had it for a while, it's no big deal. Neuropathy is a huge deal. It can create problems. It can make permanent results or even amputations. Or we have to do some kind of painful test where there's needles and shocking involved and those kind of things. And that's no fun. And it's still looking at more, why is that symptom there instead of what's the real cause of the problem? And we're just generally looking the wrong direction. We only see one piece of the puzzle instead of seeing the whole picture. I want to be able to go, okay, there's the picture that I'm shooting for. Let me grab all the pieces of this puzzle and start putting them together. If you're just testing for the symptom, then you've got a piece, and that's a good piece. We need to look at those, and there are some validity to those parts of testing. However, if you're not looking at the rest, that's where the problem is going to come in. So accurate data means finding what the puzzle is supposed to look like, looking at that picture and making sure that, okay, now I know where we're going. We know what we're supposed to be doing. Otherwise, you end up confused. You end up not sure exactly where, what target you're supposed to hit. How are you supposed to do your treatments? It's like shooting a bow blind, trying to hit the target. It's just not going to work. So how do you fix this problem? And that's where our accurate holistic testing comes in. So when I'm looking at an iceberg, for example, this is the part that most people will see. They'll say, okay, I can see there's a giant block of ice on top of this water. But technically, we need to look and say, okay, well, what's the rest of it look like? And the rest of it, of course, meaning what is under the water? What's the rest of that ice block look like, so to speak? And so when we're looking at the picture of the iceberg, it kind of gives you an idea. It's much bigger underneath than it is on top. And many times that's where the problem is. Our symptom is what's on top. Our symptom is what we feel, what we see. The symptom is a part of your body where you're like, oh, my, legs are sore, or I'm getting cramping, or I'm having numbing or tingling, or those kind of things. And that's the symptoms. Or you might see the necrosis, right? Some type of degeneration in the skin or in the muscle. And you start to have that discoloration in the leg, which obviously is a next step closer towards amputation. So we don't ever want to see that. But what's underneath is really what we need to be talking about. And that's where the root cause lies, is what's underneath. So what we do is we have a 7-point brain, body, gut exam. It encompasses a bigger picture about where your body's at. So neurologically, we look at brain balance. We want to make sure your brain waves are firing the way that they're supposed to be. The brain controls what? Literally everything. So we know the brain and the spinal nerves, which is your central nervous system, control and coordinate all function in your body. So if the brain is out of balance, if the brain isn't sending a right signal from brain all the way down to feet, then you're not going to get healing in the feet. So it starts with brain. And then spinal nerves, obviously we need the nerve flow going down your spine to have good flow so that it can actually get to your feet. And then lastly, of course, is the peripheral nerves. And that's the ones that are actually in the feet and in the toes, but also in the hands. So some of you have neuropathy in the hands. Most of you, it's in the feet. And some of you can actually be in both. But we have to neurologically assess those things. So we look at brain balance, we look at spinal nerves, we look at peripheral nerves, and then we do testing to find out how bad are they? Like, can you actually be helped, or is it already too late? And yes, there's a test for that. Next, we look at metabolic health. So I'm looking nutritionally, where is your body? Like, what nutritionally do you need to help get you in the right place? And that's metabolics. So how's your gut health? The gut is supposed to have great health all the way through your life. So there's not an age component to this. Your body should be processing food, pulling nutrition out, and you using it so that you can achieve health in your body all of your life. But if something's wrong in the gut system, and you're not digesting or not processing foods properly, you're not going to absorb, you're not going to have nutrition, you're not going to have what you need to actually allow this body to heal, whether it's feet or whether it was a stomach issue or a heart issue or diabetic issue or what have you. Your body has to have proper nutrition, and the gut is where it's going to draw it out of those foods that you're putting in. When that happens, sometimes you become toxic. You can actually, when you're healthy, your gut will take any heavy metals, for example, that get in your system, whether it's lead or mercury or arsenic or aluminum is very common, and it'll take them and actually process them through and get rid of them. But if your gut is unhealthy, it can't process out the toxins properly, including heavy metals. So your body holds on to heavy metals. It stores them in the body. So we definitely want to test the gut, but we want to test and see, okay, if it's been there a while, do you already have heavy metal poisoning of some type? And I did. When I was going through my situation, I had lead and mercury and arsenic and what have you in my body, and I had to detox it out. And then lastly, we do look at deficiencies. Do you have enough of the good stuff? In other words, do we have enough magnesium or calcium or, manganese or whatever, potassium? Do you have the nutrients you need to actually build back up your body? And in this case, build back up your feet. It's like having building blocks. I want to build a wall, but I can't build a wall if I don't have the building blocks to my health. If I don't have enough magnesium or calcium or what have you, I can't make the part of the body that's actually going to heal. So you need to have all of your nutrition in your metabolics. So think of it like this. From a structural standpoint, we need the bone, the ligament, the muscle. We need to have balance. And many times alignment issues, just the structure part being off balance, can actually lead to nerve or neurologic issues. And then, of course, left long enough, it can turn into a full-blown neuropathy. So really think about it like this. You have a structural part of who you are. That's, the physical part. And then we have the metabolic part that feeds the energy to the structure. And that way you have a ability to actually use that energy and use that body the way it's supposed to be moved. But it has to be coordinated. So that's where the neurologic part comes in. So the brain, the spinal nerves, and peripheral nerves really are there to coordinate and control all of that function. So together, they work in all three aspects of your health. They work together to allow health or to allow disease. And if you have neuropathy, it's allowed disease, and it's been going on a long time. So how does this work? So first, we want to look at microvascular blood flow. I'm not looking for whether the flow is coming from your hip down to your feet. I'm looking at the microvascular blood flow in the tips of the toes and in the foot, and also in the fingertips and in the hand. And we want to make sure that it's actually flowing the way it's supposed to in that part. So we do a thermal image or a thermal exam of that body part to say, okay, is there enough warmth in your toes? If there's enough warmth, there's enough blood flow. That's what carries the warmth. It also carries oxygen and nutrients and what have you. But it'll have warmth in your feet. So if your feet are always cold, and we measure them, and we actually measure the heat of your feet, and we measure that, and it's really cold, then you don't have enough blood flow. When there's not enough blood flow, it's easier to grow neuropathy. We also do the neuropathy severity exam. I want to find out how severe is this neuropathy. In other words, if you have a neuropathy that is a 30% neuropathy and you have a neuropathy that's an 85 or 90% neuropathy, that's an entirely different way of handling that neuropathy. Like, how fast do we have to address the cause? How quickly do we move on? Like when we see our data and we go, okay, I see that you have this problem, this problem, this problem. How fast do you need to get on it? Well, that is determined by the severity of your neuropathy. So we do the neuropathy severity exam, and we can tell you by percentage how damaged are those nerves. Are they just 30%? Are they 50%? Or is it all the way up to 85 or even 90%? When you get high numbers like that, we have to take all things into consideration, but it becomes to a point when it can get to where it's too far gone. In other words, that you cannot get better. And part of the exam is to go, yeah, well, how bad is it? How fast do we need to move? But then the other part of the exam is to go, you know what, if it's too late, I want to tell you right away. And that way you can know. Now, the problem I have with when I tell people that is some of them go, well, I've had it a long time. I'm probably permanent. Don't get into negative thinking. Don't get into this where, oh, everything's bad and it's always going to be bad and I'm just old and, whatever. Come and look. I've had people that have had this for 30 years and it wasn't too far gone. And I've had other people that had it for, 2, 3, or 5 years and had it be too far gone. So it just kind of depends on how fast it's progressing in your body, what your lifestyle choices are, how you've taken care of yourself or not taken care of yourself. over the years, and that'll tell how fast it's going to grow, but you can't tell by how bad you feel. So we do the test. If you're not to the point that you're permanent, in other words, there is a way to help, then we want to look at the spinal health, the spinal nerve health. And so when I'm looking at spinal nerve mapping, I can actually map out in your lower back, for example, there are 3 nerves that feed directly to your feet. And it's the L4, L5, and S1 nerve. These 3 nerves actually feed the heel, the bottom of the foot, top of the foot, and all the way into the toes. And depending on which area is weak, I can tell you which nerve is actually causing it. So there's a test and a way to map out which nerve is causing your neuropathy. That way you have a better chance of getting it well. If you know more specifically exactly where you're supposed to treat, it is so much easier to help. And we want to look at spinal nerve inflammation. And so with that, we look at spinal thermography, similar to foot thermography. We look at the spinal thermography, but kind of looking at it from an opposite standpoint. I'm looking to say, is there something wrong in the spine? And it'll go with that spinal nerve mapping. Those 2 things, if they match, you can be for sure that that's part of the issue and you're going to need to address it in order to get better. So how? Well, we're going to continue on looking at body alignment, x-rays, right? We want to see the alignment. I can do postural screening and other things, but the x-ray is going to show you point blank. There it is. You can see it with your own eyes. And we do the analysis to show you, here's what a normal looks like. Here's what you look like. How close do you feel? And you can see it for yourself. Either, yeah, I can see I'm right on. That's pretty good. Or you can go, yeah, it looks like I'm out of alignment. And that potentially could be causing your neuropathy symptoms. And I'll show you how that works when we walk you through it and what have you. The next is metabolic health or toxicity. And we actually have nutrient testing that we do. The first step is nutrient screening. And I screen you because there's no sense in spending finances on testing that's not needed. So during the screening, I can determine, do we think there's even a nutrition test that's needed? Or do we just go with the screening and say, no, things are actually pretty good. It's not really part of where the problem is. If you fail the screening and you need the testing, then we have testing that we can order. The next is brain health. And in our brain health, we do have brainwave mapping that we have here in the office. So if I do a brain screening, again, we start with screening, and I test and everything's good, then there's really not much of a reason for me to do the brain mapping. But if there is a problem in your screening and it shows, yeah, there's something in the brain that's not working the way it's supposed to work, then I'm going to go ahead and recommend that we get a brain mapping, and then we can tell you, where is the problem at? What is going on? How is this affecting your life, your feet? Generally speaking, at the C3, C4 area of the brain, that affects what you feel, your sensory, and your motor, what your muscles are doing. So movement and that kind of stuff. So if either one of those are active, we know that we need to address the brain. Next, gut health. So for our gut health, we have a gut health screening. They can tell me, again, do we need to look further into gut health, which we would do some blood work and testing and those kind of things if you did. But this gives you kind of an overall of what tests may be available for you if you need to be tested holistically. So when we're looking at our data, we're treating you functionally, not the disease. In other words, when I'm looking at you from a functional standpoint, you may be missing calcium, magnesium, manganese, or vitamin D, but that doesn't tell me the name of the condition, and I don't need to know the name of the condition. What I need to know is, you need more calcium or magnesium or vitamin D. I need to know functionally what it is you do, and I'm less worried about the name of whatever that is and more concerned about how do we correct this. So if you're missing a nutrient or if you have heavy metals or toxicity, then obviously that's going to be something in there. Now, we do look more at the whole picture so we can get pinpoint accuracy. If I lay out a puzzle on my table and I take one piece out of the middle, it becomes pretty apparent that you're like, hey, there's a missing piece. Well, once you start doing all of this testing and you look holistically at the body from the physical, the brain and spine and nerves and all of that, and you look at metabolics, it's pretty easy. Something will stand out. Something will go, aha, here's my issue, here's my problem, and here's what I've got going on. And it's unique data because it's you. It's your life. It's your stressors. It's your nutrition that you've had over the years, your trauma that you've had, or your good lifestyle. It's your exercise. It's the things you've done well and the sleep you've gotten and what have you. How healthy are you and how unhealthy are you? So it's a plan that's specific to you, and it's going to be unique to you. And so it's much easier to hit an accurate shot and get, hit right on that bullseye when we take the time to actually look at the puzzle as a whole. And that way we can go, okay, now we know exactly what this thing's supposed to look like, and here's what's missing. So we have accurate data. Now we need to create a plan of healing, a freedom plan to get you free again, to get your life back. So the problem with the way that things are traditionally done is that it's not really addressing the root cause. We talked about that earlier with the whole testing thing. And so we're basically misguided, in my opinion, into learning to live with it. You know, oh, you can just never get better. How many people were told that over and over again? It makes you lose hope. It makes you want to give up and not try. Or they'll say, here, take these drugs, take these medications that you're always, never going to fully get well, but they'll at least manage your symptom, not necessarily reversing the root cause. And some of those medications could be gabapentin, Neurontin, or even Lyrica. And all three of these medications are anti-seizure medications. They're not actually designed to heal the feet. What they're designed to do is actually slow down your brain. And when they slow down your brain, the way they work is they'll slow down your brain enough that you're not going to feel your feet, is more or less how it works. And so I'm not thinking that that's probably the option that most of us want, is a slower brain. And so I don't recommend going that approach. And then, of course, if it stays long enough and you don't take care of it, the next step is amputation. And sadly, you can be on the medications, you can be doing the therapy that your doctor recommends, and it not slow down the progression of that condition. And when it's not slowing down the progression because you're not addressing that root cause, you could be on the medications and you feel good. Maybe actually the medication seems, I'm doing air quotes with my fingers, and it seems to be working. And then all of a sudden you need an amputation. Why? Because the tissue got worse and worse and worse. You weren't dealing with the real cause of the problem. You were dealing with the symptom, and you felt okay. That doesn't mean the underlying cause is out of there. And so we don't want to end up going down the wrong road, going into amputation, going into other problems. So we need to make sure we address the root cause. So the freedom plan doesn't just look at biology. Basically, when we're looking at that freedom plan, we go, okay, the biology is, we end up cutting it out. The chemistry, we drug you up or change your chemistry so your blood work looks good, but that doesn't necessarily mean you're actually healed. And then, of course, the next thing, what is it? What's the thing that's going to make a difference in this? And that's physics. It's how energy relates to your body. And so biology, yeah, we have a need for that. We have a need to make sure your physical body is actually where it's supposed to be. We have a need for chemistry. We have a need to make sure that you actually have the right nutrients and other things in the body. But then we have to look and say, okay, how does all of this get managed? How does the brain and the spinal nerves actually coordinate, control all the rest of what's going on? And how is your energy? Like literally there's an energy level equation that goes into this, that if you have the energy, you can actually get better. So energy and matter and how they relate, that's what physics means. How do we fix this? The solution, regrow the nerves. That's literally the solution. And yep, they can be regrown. That's the first question I'll get is, can they actually regrow? And the answer is yes. And they only regrow very slowly. It's a little bit each month. So it takes time. But the first thing to do, get the 7-point brain, body, and gut exam. Find out what areas of neurologic balance are not working for you. In other words, is their brain imbalanced? Is it spinal nerves? Is it peripheral nerves? Or is it a combination of all three of those? Well, that's the control mechanism of everything else. The metabolic system, your gut health, are you toxic? Are there deficiencies in there? And of course, the structural, the bone, the ligament, and the muscle. Are these things where they're supposed to be? And once you get the exam, then you can make a plan on what to do. And so the freedom plan would include a metabolic structure. Metabolic meaning the nutritional side of who we are and what we do. In other words, do you have enough proper nutrition in there? Do you have the right nutrients to feed the body? Is there inflammation? That inflammation can be in the form of food sensitivities or food allergies or those kind of things that the bad gut health can cause. It can be where you have a heavy metal or you have a deficiency. Do you have enough calcium, magnesium, manganese, vitamin D, or what have you? So we're looking metabolic, then we look at structural. We want to make sure your body is lined up. Misalignments in the spine or in the feet or in the knees can pinch or the nerves that are feeding down to the feet and actually cause part of the problem. A lot of neurologic issues and or neuropathies come because of structural issues. So we want to make sure your alignment is on par with where it's supposed to be. And next is the nervous system. And the nervous system is the control. So your structure is really all about like the thing, the part of the body that we're talking about, whether it's the foot or the legs or the spine, and really, in my opinion, it's the whole thing that we're looking at. And then metabolics actually provides energy and fuel to feed that structure so it has something to work with to be able to move and do and use. And the nervous system is the coordination of that. So it puts it all together so that it can actually work and function as a whole unit. So this is a whole body system, a holistic way of looking at your health and at your life. And so healthy nerves plus raw materials equal healthy cells. And healthy cells means neuropathy heals, and it does what it's supposed to do. You get better. Imagine having no neuropathy because you're actually able to get healthy cells in your feet again. But low energy cells, neuropathy gets worse. And that's if you don't have the raw materials, you don't have healthy nerves, you don't have the coordination of that from the brain and the spine, like you don't have these things that I've been telling you need, then your neuropathy, your cells rather, will have low energy, and those low energy cells can make a neuropathy grow. And over time, that neuropathy gets worse and worse and worse until eventually you end up in amputation or worse. So what's the answer? Well, we need to charge the body. We need to nourish the cells and then manage all of that through that brain. So think about it like this. You have raw materials, vitamins, minerals, amino acids, all the stuff. But if your body's low in energy, it doesn't have the flow, let's say from the brain, it's not sending the signal, or it's not getting through a nerve coming out of your back down to your feet, that low energy is still going to create unhealthy cells. Or, you may have all the raw materials and lots of energy. So we have energy that comes from our foods. We have energy that comes from the way that our body functions and other things. There's 6 ways that your body produces energy, and you have plenty of energy, and you actually have it flowing from the brain and spine all the way down, and it gets to the feet. Then what's going to happen? You're going to have healthy cells. When you're growing those healthy cells on a regular basis, your body starts to reverse the condition. Neuropathy will actually reverse and get better, and the cells will heal, and those cells will now not have neuropathy and have damage to them where they're giving off signals of pain or numbing or tingling or those kind of things. Instead, you're going to actually start to grow healthy feet where you can walk and move and do things without pain, numbness, tingling, feeling hot or cold or like ants are crawling on you. So healthy cells means healthy body. Now, what do we do with that? We've done the test. We've gotten accurate data. We have created a plan. Which therapies do you need based on the data that we had? And then lastly, we need to accelerate that healing. How do you accelerate the healing? And of course, the traditional model, the problem is it's management versus reversal. We talked a little bit about that. We're managing the condition, right? Lots of action, but no progress. And so we're just managing. Medication dependent. So we're taking the gabapentin, the Neurontin, the Lyrica. All 3 of these are anti-seizure medications, and they don't stop the progression, the loss of feeling, the fungus, the necrosis, the amputation, or even death that comes after an amputation. They don't stop those things. So you're basically on a never-ending cycle of symptom management, taking a medication or doing a therapy just to alleviate the symptom, but never actually getting to the root cause. Whereas what we would do is we'd be saying, okay, let's look at the body as a whole. Let's put all the pieces of the puzzle together, take a look, and which one's missing. How do we actually correct that? And then once we see it, create that freedom plan that says, okay, here's how I want to address this problem. And here's the 3 things that need to be done based on my test. Could be 5, could be 13. I think it depends on your test. But here's the 3 things I need to do, and then just massive actions to go after it. And that's really my solution. Like step 3 is massive action of reversal. And this is really the easy part. I mean, if you did a test and you're like, okay, I know exactly how I'm supposed to fix this. I know exactly what I need to be doing. Now it's just a matter of doing it. It's just a matter of going forward and actually causing that healing. So what do we do from here? Well, we want to get that nerve freedom examination. It's a 7-part brain, body, and gut exam. We want to find out where your health is at. Like, how is your body? Not just how's your feet, but how's your body? Why did all this grow? It doesn't grow independently. Where's your health at? And then decide what you want out of life. Like, you got to have a goal. I set a goal a while back. I wanted to, when I hit 50, I said, okay, I want to get in shape. I want to be one of those guys that gets the, best health of his life after 50 years old. And I set out and I started working. I had a plan. I had a, image I wanted to get to, or what have you. Is just, to get healthier, to get stronger, to get all of my blood work and numbers in a good place, and frankly, to get abs. I thought that was part of it too. And so I went ahead and set it all out, but I had a goal, and I set it, and I said, okay, I'm going to do this. Next year, I'm getting pictures taken, and I've got to get it done before I get there, whether I'm 6-pack or whether I'm a keg, I'm getting pictures done. And so I set that goal. And because I had that goal, when it got tough and when I didn't want to continue, when I didn't want to do it, when I didn't want to put the work in, I would just remember the goal. Well, the same thing holds true about neuropathy. When you're working at getting better, you got to have a goal. And if you tell me, what's your goal? Well, I don't know. I was just kind of curious. I know you're not going to get better. You're not committed to the process. But if you tell me it's because somebody told me the other day, I want to be there in 5 years when my granddaughter gets married. Somebody else said, I want to be able to travel with my family next year and we're all going to Disney. Or somebody else said, hey, I just want to be able to play golf. That's a passion of mine. I've played it all my life, but lately I can't play it because of my neuropathy. See, if you have a goal, it almost doesn't matter what the goal is. You just need to have a goal that's strong enough to motivate you. And you have to decide, how do you want your life to look? Like, how do you want, things to be as you get older and what have you? So the Nerve Freedom exam, 7-part exam, we start with the neuropathy thermograph. We want to check how your feet are they warm enough? Do they have the blood flow? Next, we check the percentage of peripheral nerve damage. The spinal nerve, do you have some type of blockage in the spinal nerves that's causing the feet to get worse? Or is it just in the feet themselves? And we just check that. Nutritional screening to make sure that you actually have what you need, or do we need to do further testing? HRV testing can tell me if you have low organ function. In other words, are there other organs starting to go bad, and therefore you need to help all of that to get your neuropathy better? What's the main thing you need to do? Also go through some brain screening tests so I can see, do we need further testing? Do we need some type of brain map or what have you? Like, what is it that you need at that point? So we do some screening tests there on your body, physically screening. You can see the results as we do them. And then we also do computerized balance testing. So far, when I've tested people who have neuropathy, and we've tested thousands, we've had 5 that actually had good balance. By the time they got to us, they had caught it early enough. They hadn't gotten that bad yet. And I would say most of you, if you can't feel your feet, you're going to lose your balance, right? That just kind of makes sense. So in this case, most of you will have bad balance, and we want to measure it and see how bad it is. And then what do we need to do to actually get it better? Remember, I'm all about what do we do? Functionally, how do we fix this? I'm not about the diagnosing and naming conditions. I just want to go, what do you need to do to fix what your problem is? But here's where, it comes down to, I don't want anybody to wait and let neuropathy get worse. Neuropathy is a progressive condition, meaning over time it gets worse. And now there's 2 paths to your health. Either you're moving toward greater health or you're moving away from it. What will your last 10 years look like? Will you move quick enough for a game of tag with your grandchild? Will you be strong enough to embrace every moment? Will you grow old with vitality, or will you grow old with disease? It's time to decide. What's the life that you want to live? And the way to do that is with our freedom plan. And that is accurate data. Number 1, get the test. Find out where your body's at from a holistic standpoint. Number 2, develop a freedom plan. What is the plan that's going to get you free from this symptom and free from this problem? And number 3, how do we take massive action to accelerate this healing? That's going to get you your life back. That's going to get things turned back on. Now, this is where it comes down to it. You now have a choice, right? You can choose to do nothing, and you'll keep getting worse like you have been. You'll keep getting the symptoms like you have been. Your life will keep going like it has, and potentially get worse like we just saw in the previous few pictures. Option 2, you can waste time, money, and energy trying to go it alone or trying other methods. In other words, I'm just going to try to figure this out on my own. And you might be able to. I mean, I figured this out as well, but it took me over 25 years of study. If you want to save time, money, and energy, that's where option 3 comes in. And that's, using a proven process and a team of people who can actually help you to get there. Somebody who's been there. That's me. I've been there. I had neuropathy. Or I was able to get my neuropathy better. I want to be able to show you how you can get yours better as well using the TriWell testing system and the Freedom Health Plan. Now, you can choose to implement a proven process. My team sets aside about 15 hours in the upcoming week for me to be able to interview patients and to be able to go, okay, is this something that will help you? In other words, is it a priority for you? Is it something you're willing to be committed to? Is it too far gone and it's already too late for you to get better? You get clarity on the what and the how. In other words, what's wrong? Where are you at? What's your body doing? And how? What's the freedom plan? How are you going to get there? And you get clear on both. When you're clear about something, it's easy, right? When you're confused, it makes you want to just sit down and take a break. You're like, I don't know what I'm supposed to do. So we show you how to get clear. What's causing the neuropathy? What is actually happening in your body that's allowed it to grow? And then once we know that, how bad is it? Maybe you're at 40, 50, 80% damage. We go, okay, now that we know how bad you are and where you're at, what you need to do, how do we get it better? And we come up with that freedom plan. We say, okay, here's the freedom plan. Here's what the 4 things you need, the 8 things you need, all 13 maybe that you need to get yourself back on the right track. And if that makes sense, then I'll share with you the whole program. I'll share with you the neuropathy program that will actually change your life and get you going on the right track and get you better. Why? Because we believe in actually helping people first type of care. And we want to help. Basically, if it's a great fit and we want to help, then we might accept you as a patient. The reason I say might is really it comes down to a lot of, are you committed? And, I only want to work with people who are committed because I know they're going to get good results. People who just aren't committed, they don't want to put in time, energy, or even finances into a process. I know that they're not going to get the best results because they're not invested. They're not ready to truly get well yet. They're just curious. Now, we can only accept what we have available. So we only have so much time that we've set aside this week and the next week to be able to interview people. And then we're, that's the amount of time that we have. And so what we have is available right now. And if you're interested, I want you to book it now. I want you to book a time. We aren't going to try to convince you. We're not going to try to talk you into anything or anything like that. But if you want more than just drugs, surgery, loss of feeling, fungus growing, necrosis, amputation, or death, then the decision is easy. The decision, do you want a life missing out on experiences, holidays, travel, leading to amputation or even death? Or do you want a life where you take back control and you have the freedom you deserve? So really the decision's up to you. We're here to help. I want you to get your life back. I want you to get freedom again and have that freedom to live. Book your call today. I'm looking forward to talking to you.